Erectile dysfunction is the difficulty attaining or maintaining an erection which is sufficient for sexual activity. That can be very different man to man. So for some guys, that can be you can get the erection, but you have difficulty maintaining it. For other men, it can be difficulty with the consistency and quality of the erection. And then for some others, it can even be just getting an erection at all. Erectile dysfunction is very common, probably more so than men like to admit. 1 in 4 men over the age of 40 will experience some degree of erectile dysfunction after the age of 40, and that only goes up year after year. It can be a very isolating experience despite it being quite common because men like to keep it private. Erections are very sensitive to a lot of different factors. The biggest factor will always be blood flow and vascular supply, but there's so many other contributing factors. Things like nerve innervation, psychological and emotional stress, hormonal status, all of these play into getting a good erection. And so because there are so many factors that contribute to it, anything that affects any of those factors will actually cause erectile dysfunction in men. Very common medical comorbidities, including diabetes, high blood pressure, any cardiovascular disease, the medications that you even use to treat those conditions, depression and anxiety can all affect your erectile quality. Erections can also suffer following cancer treatments for things like prostate cancer and rectal cancer. Erectile dysfunction is most commonly diagnosed based on clinical history and your own personal experience with sexual activity. However, there are also sexual questionnaires that exist that help us assess the severity and specific issues related to sexual dysfunction. Lab testing is also a very common part of my workup for men. Imaging also plays a role, particularly in men who have undergone prior surgeries in the pelvis or trauma. I often get patients questioning what they can do to help prevent erectile dysfunction or make their erections better. And my baseline recommendation is always do everything to live a healthy lifestyle. That includes a low-fat diet, regular exercise, and maintaining a healthy lifestyle that contributes to good heart health. Anything that really helps your heart is likely to also help your erections. You may be able to start your initial evaluation and treatment with a general urologist or primary health practitioner. A lot of oral medications exist out there, such as Viagra and Cialis and Levitra. These are now available in generic forms, so they're very affordable and accessible. Unfortunately, oral medications don't work for everyone. And when those fail or they don't really give you the result and reliability that you're looking for, you may benefit from evaluation from an ED subspecialist, such as myself, who can really do a more focused examination and treatment plan for you.